I'll turn it over to Jay Sethi, who will introduce our speaker. I do ask that everybody mute or turn off their cell phones.
Thank you, Steve. I was going to say that, but you covered it nicely. The topic is great, very meaningful to our active senior community, and we have a great speaker tonight. The topic is close to my heart, as in my past life. As a medical director at Novartis, I was involved in bringing in a drug called Exelon to the marketplace. At that time, I'm talking about 25 some years ago, it helped to arrest the progression of the disease a little bit. And I think Dr. Carter might touch a little bit on if and what progress we have made in that direction. So to introduce Dr. Carter, she earned her MD from Cooper Medical School at Rowan University and completed her medical residency there. She then moved to New Jersey to complete her residency in Geriatric Medicine Fellowship training at Morristown Medical Center. Dr. Carter is affiliated with Cooperman Barnabas Medical Center in Livingston, and she practices there. Dr. Carter.
All right. Good evening, everyone. I hope you can hear me okay. Please stop me if you can't. Let me see if I can raise this a little bit. So I'm Dr. Carter. I'm happy to be here with you all tonight. As Dr. Sethi mentioned, or Jay, as you guys know him, I am writing from Livingston over from Barnabas Medical Center. I am one of the geriatricians there. I understand they also have a group closer to you here in Somerset as well, if you're interested in seeing a geriatrician. And so for tonight, we are talking about memory loss and memory changes that may be normal with aging, and perhaps some memory changes that are abnormal and worth seeing a doctor to talk about different treatment options. And so we can go to the next slide here. Part of normal aging that can present as mild forms of memory loss would be things like misplacing your keys or walking into a room and thinking to yourself, why did I come in here? What was I trying to do? Why am I in this room? All of that is normal. You might have experienced that for many, many decades. You might experience it a little bit more frequently as you get older, but that is normal, nothing to be alarmed about. Sometimes, especially if you're meeting me as a new acquaintance for the first time, you might say, who the heck is up here talking to us? And what is her name? Because I forget it already. Also normal, I'm Dr. Carter, and so that is all normal change. Sometimes, especially after retirement, forgetting things like day of the week, even the date or the month also can be normal. You might have a harder time learning new skills or multitasking. So when you hear a phone ringing and you're trying to pay attention, that might be a little bit more challenging than it had been in the past. We can keep moving forward. I'm sorry, I have the animations for each bullet point is separate, but we will have these slides available if you guys want them. It's also being recorded as a video. And so on to the next slide here. In terms of abnormal changes, things that might raise a red flag or something to be alarmed about if you see it, if you notice it in yourself or notice it in a loved one or a friend, things that are disrupting your routine daily life. If you're having challenges or difficulties solving problems, things that used to be familiar to you, and now suddenly they're taking twice or 3 times as long, or something that you can no longer complete. Things like if you were previously the financial manager for the household and now suddenly you can't balance the checkbook, or you're missing payments, those types of complex tasks are a little bit more worrisome. We can keep moving forward. I'm sorry. I'm not sure if it's easier for me to hold on to the mouse just to get to the next slide here. If you are also experiencing changes like becoming disoriented in what used to be a familiar place, perhaps you're visiting with a family and you've been to their house many, many times, but suddenly 30 minutes into the visit, you tell yourself, why am I here? This doesn't look familiar. Why am I not home right now? That would be alarming if you see someone having that type of change. If you're suddenly having difficulty understanding visual relationships or misjudging distances, things like walking through a doorway that used to come as second nature, but suddenly if you're having trouble gauging how far away the doorway is or how wide it is, and now you're bumping into the furniture, that's another alarm sign. And so we can keep clicking through these as well. There's about 6 more to click, just so you can read it as I'm talking. If there's new difficulty speaking or writing, things that used to come as second nature, but now suddenly you're stumbling over your words in normal conversation, or having difficulty writing legibly in a way that used to be normal for you, not Dr. Wright, like what I do and what Dr. Sethi might do. But if you're losing your normal penmanship, that might be a cause for alarm. If you're having change in your routine self-care, so maybe you're skipping your normal shower, or maybe not bathing for a week or 2 weeks at a time, and suddenly people are noticing, gosh, this person used to be so well put together, what happened? And maybe that's the red flag that causes you to reach out for help. If you're becoming more withdrawn or not participating in things that used to bring you joy, that's another big cause for alarm as well. And so we know on the next slide here, memory really exists on a spectrum. It's not something that's black and white or cut and dry. There's no definitive line between normal aging memory changes versus true disease, dementia type memory changes that are more permanent. And so it might start very mild as what we call a mild cognitive impairment, that it's not impacting your day-to-day function. You're still able to carry out routine tasks. Maybe you're not noticing it yourself. Maybe your loved ones aren't even noticing it until it gets to more of a mild dementia, where suddenly those routine activities, things like self-care or taking care of finances or preparing meals and taking care of yourself, becomes more challenging. And so mild cognitive impairment, if we click forward, has a little description here. So this is more difficulty with complex tasks, losing track of things like dates or time. If you are still working or volunteering, maybe you're having more difficulty completing those tasks that used to be second nature. If you compare it, if you click forward again, there's a good table that estimates the overall mental age of someone with these types of changes, and you can compare it to somebody that may be like a 12-year-old or a young teenager, things that they would be responsible for, which suddenly this person who may be 60, 70, 80, 90 years old and has been doing all of these adult tasks for a very long time suddenly is more on par with the teenager mental level. This can continue to progress. So in the realm of mild dementia, when it becomes clinical and something we want to treat, they may be having more difficulty with things like planning, traveling, driving, coordinating long trips if they're taking a train or a plane, cooking, cleaning, taking care of the house, paying bills, using a phone. This mental age declines even further to more on the realm of about 8 to 12 years old, and then continues to progress over many years to the realm of moderate or severe dementia, where those very simple daily tasks, things like getting dressed, getting up out of bed, using the bathroom on your own, becomes very difficult. And they may become more impulsive or lose that social filter that they used to have. Here, the mental age is about less than 7 years old, or a very young child, and can continue to decline to the mental age of a toddler. And so certainly it's worth noting these changes and having increased supervision as they're continuing to progress. And so to put it more simply, what is dementia? And so on the next slide, you'll see dementia is really an umbrella term. It encompasses all of these spectrum of changes that happen from mild preclinical disease to true dementia-related changes. There are all sorts of different types, and so Alzheimer type dementia is the most common, which we'll talk about today. There's also structural type changes within the brain, things like frontotemporal dementia, which can present with more of a personality change. Things like Lewy body dementia, which might present with symptoms that are more similar to a Parkinson change. It's not true Parkinson disorder, so that's a good distinction. And there's even other types like a vascular dementia, which might present after an event like a stroke or a heart attack that may affect the overall blood supply. And so On the next slide, we'll see there's over 50 million people living worldwide with Alzheimer type dementia. It is very common. Again, there's many different types. It is a chronic and progressive decline in overall cognition, and it's sufficient to affect your overall daily life and daily functioning. That's the key distinguishing factor. Unfortunately, with any of these types of dementia, there is no cure, and so there are treatments along the way that can help monitor the symptoms and improve the overall quality of life. But unfortunately, there's nothing to reverse the permanent changes that do come about. And so early detection and getting connected with your doctor early on in the disease is really imperative so that you can get started on some of these treatments that are available to help slow the progression of disease and maintain that quality of life that you have early on at the earliest signs of memory loss. And so what is Alzheimer type dementia? We know that this accounts for about 60 to 80% of memory changes and true dementias. It's not the only type of dementia that's out there. It is affecting up to 6 or 7 million Americans. This is a bit, the next slide is a bit of an old graphic. And so here in America, it's very, very common, especially in our older adults. It is caused by an accumulation of misfolded proteins within the brain structure. And so on the next slide, you'll see that it can actually shrink the brain tissue over time. Where on the left there, you see the healthy brain versus on the right side, it gets much smaller and shrinks into itself with the misfolded proteins that accumulate with Alzheimer type dementia. Sometimes it's due to genetic changes, sometimes it's due to lifestyle and environmental exposures over a lifetime, so it's hard to pinpoint for each patient exactly what's causing it. But there are some labs available that can help detect if there is a genetic predisposition within the family. And so that's if you keep clicking, there's an ApoE4 mutation that we can look in the blood work to see if someone is a carrier for that high risk of Alzheimer type dementia. It is slowly progressive, and so on average, it does last up to 4 to 8 years from the time of diagnosis until the patient passes away. And usually they don't die because of the dementia, it's more so as a result of the functional changes that come because of the memory loss. And so things like decline in self-care might leave them more vulnerable to infections or hospitalizations, or maybe having a fall or an injury that's difficult to recover from. Some people might have this disease for up to 20 years. And so it's really on a big, big spectrum. It's hard to predict once you do have that diagnosis. And so for Alzheimer's disease specifically, the overall diagnosis does involve memory testing, doing a neurologic exam, doing some blood work and imaging, looking at the changes within this brain tissue. The treatment goal, again, is to slow the progression of disease and preserve that overall quality of life. And when you see a specialist like a neurologist or a geriatrician like myself, they might recommend certain behavioral or sleep changes that can improve this quality. There are some newer treatments like Dr. Sethi alluded to, and so we won't go into too much detail, but again, these are infusion type medicines called Leqembi or donanemab or Kisunla. And so they're most effective when they're started very early on in the stage of disease. Once you get to more of a moderate or late stage disease, they really don't have much benefit and they come with a lot of side effects. And so again, at that earliest sign of change is when you should be getting in touch with your geriatrician or with your doctor and having some of these tests done so that you can get connected with the treatment. And so just to briefly touch on what are some other causes for memory change? There are some temporary causes for memory change, things like infection or delirium. If you're in the hospital and disoriented from your normal routine, you can have a temporary lapse in memory that could last up to hours or days, sometimes up to weeks or months. There could be causes for amnesia, such as a physical trauma. Even emotional traumas can cause short-term memory losses that's reversible. It might be medication induced if you're having a side effect from some high-risk medications. Again, it could be caused by infections, even things like a disturbance in your sleep. If you don't sleep very well one day, the next day could make it harder to continue to function at your normal level. And that's certainly very common is if you're having any mood symptoms or depression or anxiety, those long-term mood changes like grief can certainly impact cognition on a more temporary scale that's reversible once you get the appropriate treatment and talk to someone about those memory changes as well. And so just to briefly touch on how can you be proactive and what things can you do today? And so with any of these types of memory changes, there are certain parts that are non-modifiable, like if you are a carrier for that high-risk gene, the ApoE4 allele, certainly we know in general with these memory changes, they do increase as your age gets higher, which we can't control time. Unfortunately, you can't turn back the clock there. But there are all of these areas in this blue or purple here, things like your overall lifestyle. So staying involved in all those groups, I loved hearing about that at the start of this meeting, staying involved with the community, taking care of your overall health and nutrition, so eating the right foods, staying physically active, staying emotionally active in community events with your family, your friends, with these groups here. So you all took a really big step already just coming to this meeting, which is good to see. Even things like if you do have high blood pressure or hypertension or diabetes, staying on those medicines and getting those numbers controlled can really have a huge impact moving forward in your life. And then certainly improving your sleep quality, talking to your doctor if you are having trouble sleeping, maybe going to the future talk that Jay is hosting about sleep quality and what to do for that. That could be important. And then importantly, if you are having any sensory loss, like a loss of hearing or vision, making sure that you're getting that treated, because if you're not signaling to those neurons over time, you can actually have permanent loss. And so it's important to wear the corrective glasses or hearing aids if needed and get that treated as early as possible that you're starting to notice those changes. And so this is on the next slide is just a good summary in terms of how to be proactive. There are recommended diets like the Mediterranean diet or the MIND diet, which combines the Mediterranean with more of a heart healthy DASH style diet. There's even a Blue Zone cookbook. It was a show on Netflix, which points out certain areas of the world geographically where people tend to live longer because they have really well-balanced diets that are high in fiber, high in lean proteins like chicken or turkey, low in processed foods, and high in whole grains. And so those are all healthy foods to stick by. The overall goal in terms of staying active, you want to aim for about 30 minutes a day. You do want to stay involved in the community, stay curious, maybe try something new, maybe go to some of those events that were mentioned earlier. Even if you might think maybe this isn't for you, it would be good to kind of flex your cognitive muscle and try something new in that realm. And then certainly using memory tools like calendars or to-do lists, writing a note to yourself, those are all good adaptations as well. Aiming for that 7 to 8 hours every night. Trying to avoid toxins to the body like alcohol or smoking. Really, no amount is safe for your overall long-term memory and brain function. And then lastly, if you are noticing any mood changes, especially if it's persisting for a few weeks that you're feeling down or depressed or stressed and not feeling like yourself and maybe feeling more isolated or not interested in doing the things that you enjoy, make sure you seek help and talk to someone about it, because there are good treatments that are available. And so in terms of being proactive, you do want to stay connected with your primary care physician. It doesn't have to be a geriatrician. I'm a little biased. We do a lot of good work in the primary care realm, and so we are available. But early detection really is crucial, especially at that annual Medicare wellness visit, where they do routine memory testing for you, just to check in. And so if there's ever any concern for yourself or for a loved one or for a friend, make sure that they're getting checked. And then I do have a little bit of a quiz for you guys for today. I have it as a paper handout if you want to grab it on your way out, but I also have it on the screen on the next slide here. That there is a way to self-screen symptoms either for yourself or for a loved one. Here, I'll pass. Let me see if this will work. Can you guys still? Oh, perfect. It is working. So I'll start passing this around. This is a short quiz. Here, if you don't mind just passing it through the rows. That you can answer. It's just a self-answered survey. And so what you do is you go through the questions 1 through 8 and then check off if there's been a change or has not been a change in each of the 8 domains. If you are checking yes for 2 or more of the columns, or for the rows, I should say, then that is concerning that you should have a more specific memory test done. And so this goes through if there's changes in terms of overall judgment, problem solving, making decisions, if you're becoming less interested in hobbies or activities, maybe becoming more repetitive, having trouble learning to use new tools or gadgets like the microwave or remote controls, forgetting the correct month or year. So it's normal to maybe forget the day of the week or the date, but if you're losing track of the season, that's a little bit more concerning. Having trouble managing complicated financial affairs like bouncing the checkbook or missing bills. Having trouble remembering appointments, and then daily problems with thinking or memory. And so that's really important if it's every single day. Again, this can be completed for yourself or for someone else that you might know that you're worried about. And so if it's 2 or more in that yes column, that would be when you would want to seek additional testing and additional help. And then on the next slide, I have some good resources that are loaded with a ton of resources and education in terms of memory changes and where to get help in terms of the Alzheimer Association. There's a New Jersey specific organization and then a few government pages as well from the Institute on Aging and Alzheimer.gov. And that wraps it up. If you guys have any questions, I tried to make it quick so that we have plenty of time to answer questions.
The card is open for questions. Any questions, please?
Some of those. Is it helpful to take Prevagen or some of those gummies you see for brain health?
Yeah, so Prevagen is a good supplement. They don't have, in the research world, we look for things like a head-to-head trial to support it versus taking a regular multivitamin. We don't have that data, but we do know that it is protective for overall brain function and it has a lot of good nutrients in it. So that's good to take. Good question.
Thank you. Both of my parents had major dementia, 90 and above. How worried should my brothers and me be?
And so I missed the type of dementia. You mentioned age related. And so it's hard to say without knowing their full medical history. Again, with the different types of dementia, for the most part, a lot of it is based on overall lifestyle and things that might have changed over the generations that may not be affecting you and your brothers in the way that it affected your parents. So things like if they were smokers, they're probably a higher risk for like vascular type dementia that's more lifestyle related. If you want additional screening for things like Alzheimer type dementia, there are the genes that can be tested to see if you're high risk. But more important than that is keeping track of the symptoms. And so at the earliest sign to make sure that you're getting the treatment, you or your brother getting connected with your doctor early. Yeah, of course.
Doctor, the information that you gave us on that screen, there's a lot of information there. That's very interesting. How can we get a copy of that?
Oh, so I heard this is recorded, and I do encourage you guys, certainly you're welcome to share these slides. And if you go back to the slide before this, those 4 pages, the links that I included, those are the best resources for getting even more information. So one more forward from here. 2 forward. There we go. These 4, that's the best resource that's very user-friendly to click through, and they have reading material, they have videos that you can watch and learn even more.
So you get them online?
Yep. But these slides, like I said, they're free to share. I would just ask either. Yep.
Okay, thank you, doctor.
Yeah, of course. I can hear you, but not through the mic. Yeah. So the first question was asking if CoQ10 is helpful. That is a good supplement, again, for overall vascular health. So it's not necessarily specific to memory or being proactive for your memory, but it's similar in line with keeping up with the active lifestyle, the balanced nutrition. If you want to add in a CoQ10, you can. If you're already eating that low fat, high fiber, good lean sources of protein, you may not need it. But everyone's a little different. If you have heart disease risk factor or vascular risk factors, it doesn't hurt to add that one in. In terms of the second question was asking whether things like Alzheimer or different dementias are genetic. And so we really know specifically for Alzheimer type dementia that there are those, that one mutation that I mentioned, the ApoE4 gene. If you have that mutation in 2 copies, then it's a much higher risk for that Alzheimer type dementia. There's different forms and different copies, so we won't go into the specifics. But again, that is a genetic test that could be tested within just regular blood work at the lab.
I believe I saw in your notes something about air pollution. Could you elaborate a little on that?
Yeah, so I grew up in South Jersey, and so I don't know if any of you are from the Ocean County, Toms River area, but I grew up in an area where there was a lot of air pollution and a lot of nuclear waste, and so things like environmental pollution, air pollution can definitely increase your risk for overall health diseases and cancers. In terms of memory changes, the biggest concerns would be things like smoking or exposure to like emissions from vehicles and things like that if they're unfiltered, that over a lifetime can affect your overall vascular health, which can affect the blood supply in your brain and lead to memory changes. And so there's a lot of different causes there. We won't get too bogged down in the details, but that's why personally I'm a little biased, but environmental health is a really key issue to get involved and be proactive about. We've made some good changes, so.
Any other question?
Can it be recognized by blood work?
Yeah, so that ApoE4 mutation is a blood test that could be done in just in routine blood work. It has to be ordered for that specific test from your doctor, but you could ask them to check for it. Yeah, good question.
Okay. Yes.
A question from the peanut gallery. What's coming down the pike? What is the research starting to show? What are you hopeful about?
So there's a lot of promising changes. And so I came into geriatrics very recently in the past few years, really, through my training. And so those 2 infusion medicines, the Leqembi and donanemab is how I know it. They're managed by neurologists, but they're very innovative and very beneficial. Again, if it's at the early stages of dementia, that they can actually clear out those misfolded proteins and get rid of the physical damage to the brain. And so again, it's not a full cure, but it is one of the most promising that it does extend the overall quality of life longer than any pill medicine that we can offer later on in the disease. They do come with a lot of side effects, and so that's why they're strictly managed by neurologists. It is an infusion medicine, and so it's not something that you can take at home. You have to go routinely for things like MRI tests and head imaging, lab work, about every 3 weeks. And so it's a little bit cumbersome. I'm hopeful that they might get a better solution that can be spaced out a little bit longer, and maybe extend the benefit a little bit later into the disease. Right now, we're not quite there, but I am hopeful with some of the changes that are coming out. Good question.
With regard to Prevagen, is that something that you might recommend to take prophylactically, or something if you have perhaps some of those symptoms that would not be symptoms of concern?
So it's more of a prophylactic. It's not a treatment. So once you do have symptoms of concern, it's worth having a visit with your doctor to go through the different treatment options. But it doesn't hurt to add that in either prophylactically or after there is a diagnosis. But it is more on the prophylactic side. I'm going to see a couple more questions.
What is the issue with amyloid plaques?
Yeah, so those are part of the misfolded proteins that can accumulate within the brain. And so that's part of the physical damage that can affect the overall neuron or cell-to-cell connection within the brain tissue that causes the memory loss. There could be amyloid plaques or tau tangles are the two common misfolded proteins. And so you can see on specific brain imaging, we can actually scan specifically for amyloid buildup. If we do a PET scan, we can see general changes that are consistent with amyloid protein accumulation with just a regular MRI of the brain. And there actually is a newer blood test that can do, similar to the ApoE genetic test that's done in the blood. There's a new protein panel that can look for those misfolded amyloid plaques or even the tau tangles in the blood, because as they're present in the brain, they kind of circulate throughout your body as well.
We live in Franklin Township, and we're quickly becoming the warehouse capital of the state. And they're going to have a lot of diesel trucks emitting fumes. In your opinion, will that affect the environment we live in and the health of our community?
So yes, would be the short answer. The long answer is that a lot of those environmental exposures, even if you're getting exposed now, take 20 or 30 years to actually have a true impact on your health. And so it's more worrisome, especially for things, people like young kids that are exposed to it over a lifetime. But it is worth advocating for cleaner vehicles, electric vehicles, because there are better ways to have these warehouses, and that's where getting involved like you guys are, and having that momentum to advocate for the community as a whole is really important.
Thank you.
Of course.
Hi. Other than the smoking and lack of sleep and nutrition imbalance, is there other lifestyle factors which affect adversely to the neurological?
So I heard the question in terms of lifestyle factors that can impact cognition, in addition to things like smoking or lack of exercise, dietary changes, lack of sleep.
Yeah.
And so those are the big ones that are modifiable. Again, if there's any known disease that your doctor is treating, making sure that you're taking those medicines and working towards the treatment goals. And so that might be working towards a blood pressure number, making sure you're not treating too low, and so your blood pressure is not tanked, because that's also a problem. But getting that blood pressure in that sweet zone, controlling things like blood sugar and cholesterol numbers, those are also really important. Keeping up with those annual wellness screenings are very important. And then just generally for your overall mental health, staying involved in the community or in a religious group if you're spiritual, staying involved with your family and friends and staying connected with routinely having those meetings are very important as well.
Thank you.
Of course.
Is the blood test for the amyloid for light chain?
Say that again,
Is the blood test for the amyloid called light chain blood test?
Oh, so that's a different test, looking at light chains. That's more so looking at immunoglobulins. This is called an ATN profile, if you want to ask your doctor for that. But again, it's usually not ordered unless there's specific memory changes that are happening.
Great presentation, such an important subject and great questions. So we are really thankful Dr. Carter. Let's give her a big hand.